Hello and welcome to our Masterclass by OpenUp. My name is Gabby and we're very excited that you're joining us here today for a Masterclass about female health. Whether you're tuning in for the first time or you are a returning viewer, at OpenUp we are on a mission to make mental well-being accessible to all. And one of the ways in which we do this is by organizing these monthly masterclasses on different topics related to our mental well-being. Today's masterclass is going to be hosted by Rianne, who is a medical doctor and lifestyle expert here at OpenUp, and she's renowned for her knowledge in all matters related to pregnancy, female health, and hormones. Before we get into the masterclass, a few technicalities. This is an interactive masterclass, so you will see that in the bottom right of your screen, you have a chat function. This is where you can interact with Rianne, and also this is where you can interact with each other. We are also going to have a Q&A at the end of the session, so if you have any questions that you would like to ask Rianne, you can drop them in the Questions tab, also at the bottom right of your screen. And this way other people can also upvote your questions, so the most popular questions are the ones that are going to get answered. At the same time, we're going to have a little bit of interaction with you through polls. So these polls are going to pop up on your screen. You can put in your votes and then you can check the answers in the polls tab, once again at the bottom right of your screen. You can also use the reactions and emojis, and Rianne is going to see that as well. So we really want to foster some interaction between you guys and also Rianne. So without further ado, enjoy the masterclass and please welcome Rianne.
Hello everybody, welcome. I am honestly thrilled and proud to be here with you today to talk about female health. So give me a thumbs up in the chat if you also feel like that. And maybe you wonder, why is she so fond of talking about female health? So on one hand, as a medical doctor, I've seen so many clients with a lot of complaints connected to their menstrual cycle. But also here at OpenUp, as a lifestyle expert, I see many women benefit a lot from having more knowledge about their menstrual cycle. And men, thank you for being here to learn more about the menstrual cycle of your partner, a friend, your mother, your sister. This is the way how we can support each other. So what are we going to look at today? These are our goals of this session. First, we're going to look at to understand the hormones and the menstrual cycle. Next, we're going to see can you recognize on your own body, what kind of signs, signals, and perhaps symptoms you can recognize in each phase, each part of the menstrual cycle. And last but not least, my favorite part is to look at practical tips to support the balance of your hormones. And then you think like, yeah, but what's the benefit of this all? The benefit of this all is to get more in tune with both your body and your mind, to make more appropriate choices that they are aligned with your body and your mind, to use your energy efficiently and to work with your hormones instead against your hormones. And yeah, I just read the following item. So women, what do you think? How many men do know what women experience on a monthly basis during their menstruation? So what you see here is our members of the parliament, of the Dutch parliament, and they have been experiencing with a special device what the level of menstrual cramps is that women can experience on a monthly basis. So what this item shows to me is that we have in many places in society still a knowledge gap concerning female health. So that's why I'm so enthusiastic with you to talk with you today about female health. So let's start together. And before we start, let me know in the chat, what cycles are you familiar with? When you hear the word cycle, let me know in the chat. So when I have to answer this question, day and night is one cycle, all the seasons, winter, spring, summer and autumn, but also cycles in our body, the sleep and awake cycle, the inhale and the exhale, but also of course the female cycle, the menstrual cycle. And I do see happening same kind of answers in the chat. Thank you for your participation. So here we are, the female cycle and two of the most important hormones for a female body, estrogen and progesterone. And to me, as a medical doctor, I'm honestly fascinated about hormones. Not only about these hormones, we also have hormones connected to our stress levels, to our blood sugar, to our sleep. And all of these hormones, it's like an orchestra. It's all of them influencing each other. So it's really a symphony, and this isn't a romantic notion. This is the way how it is. There's this neuroendocrine system from the brain all the way through our body. All of the organs are influenced by the hormones. So the female hormones do influence the uterus and the ovaries, but they also influence the other systems. And that's where we're going to look at today. So for this masterclass, we choose to use the metaphor of the seasons that are happening each month in the female body. So perhaps you know this metaphor: winter, spring, summer and autumn. So this is a very easy metaphor to get in touch with these different parts of the season. And today we will look at each of these parts deeper. Here we are, the 4 seasons. Winter is our time of the menstruation, the time that the female body is bleeding. Then we have the other very well-known moment is the ovulation. This is the summer. The vibe of summer is in many women also happening during the ovulation. And in between you have the spring, which is pre-ovulation. And then we have after ovulation, autumn, which is pre-menstruation. And we will look at each of these phases together. So winter. Hey, I'm curious. Let me know in the poll that is showing up right now. I'm really curious if you experience any of these signs or symptoms if you have a female body right now. So the poll will pop up and I'm curious to look at your answers. I will continue already. Menstruation. So this is the moment you just saw on the graph that the hormones are low. Hormones are low. This has an influence on other neurotransmitters in our brain, for example, serotonin. And this makes us feel maybe a little bit less happy. It's time to rest, to digest. And no, this will benefit you. The more you rest in your winter, the more you will shine during your spring and summer. So please take this time. The ligaments in the lower belly change a bit. This can give a little bit of a tensed feeling in your lower belly. So it's still good to move. For example, gentle walks, yin yoga, anything that helps to give some ease to the lower belly because the uterus is changing in its position during menstruation. But also time for meditation, to reflect how was your cycle and what are the intentions for the new month up to come. And I see lower energy levels, lower belly cramps. People have this a lot. Being more creative is possible if we do give in to this desire to slow down. Women can also experience a higher level of creativity because we have the rest to go inward to have more creativity. So maybe it's something nice to try out. So here we are in the graph. You see both estrogen and progesterone are low. And then we come into spring. And you know about spring, this is the time to go out. You know, we open the doors. And this is just the time after menstruation. Estrogen, important hormone in this phase of the cycle, is rising. And estrogen is a hormone that's making us feeling energized, sexy, mentally clear and curious. So we crave social contacts. Why? Because we are looking for a potential fertilizer. But be aware that summer is still coming. Be aware that there will be a time with even higher levels of energy. It's a good time to do some brainstorming and to use your creativity and inspiration. So here we are. Estrogen is the accommodating hormone. It's the one who's welcoming the outside world. It's ready to meet other people. So both in your behavior but also in your body, we see that estrogen is making the uterus ready for a potential fertilized egg by making a new lining of the uterus, letting grow new blood vessels, so a potential fertilized egg could find there a good home. What we see in studies, actually, estrogen makes our facial features more symmetrical and our skin mostly more clear. And this means that we are more attractive to potential fertilizers. And not only that, estrogen also makes us more empathic and able to recognize facial expressions of others. So estrogen makes us more easy to be in touch with others. And last but not least, estrogen also lowers the volume of your inner critic. So many women experience that they are not so easily insecure and more easily secure, self-secure during this period, during this part of their period, their cycle. So here we go. Estrogen is rising, progesterone is still a bit low. And then there is the moment. We're gonna have changes of hormones. This is summer. This is ovulation. This is the time many women feel a lot of energy, feeling sexy, physically and socially strong. So this is the time to have your long to-do list. See if possible to plan big tasks now. And it's easy to care for others. You can rule the world. That's what many women experience. Emotionally, you can feel at ease, but you can also feel anxious. And maybe the poll will show up. I'm curious how you feel in summer, actually. Why is this anxiety also possible? Because of these changes in hormones, you just saw estrogen is rising and all the way lowers down. And progesterone is slowly rising. These changes can have an influence on substances in your brain, neurotransmitters, serotonin and dopamine. And if you are vulnerable for this to sense more anxiety, it can, because of these changes in hormones, that you're more prone to have anxiety for any kind of topic. So please, even though it's your ovulation and many women experience a feel-good vibe, if you have more anxiety, know that this is normal too. And please listen to your body. What we talk about now are certain general characteristics if we look at many women. But I'm always a supporter to listen to your body, what you need in this moment, in this phase. And if it's different than the general characteristics, then I'm your number one supporter to follow that. So I'm looking to the poll, and we do see socially strong, higher libido, an increase of vaginal discharge. Why more discharge? Because this makes the entrance of the vagina more easily to go through for a potential semen, so potential sperm cell to fertilize the egg. There are also women who do feel anxiety, so I hope by knowing this now that this is also in the range of normal. So here we are, we do see these changes of the hormones, estrogen, slowly progesterone is coming up. And then we move into autumn. Yeah, and autumn is the time to slowly go inward again. And this is what our body needs too. Yeah? As women, we are a cyclical being. It's not linear. This is the time to get a bit more rest already. Because the lowering of estrogen, we get more susceptible for inner critic. And this is sometimes what women experience, that they're more emotional. But some women also experience they're more fiery or flammable. Be gentle with yourself. Slow already down and take the time to look at, okay, what is really still need to be done before winter is starting, before I really go into rest? And what are the things that take too much energy and I actually can let go now or let someone else do it? So in that way, it's a cleanup. In our body, you might notice also already that the energy level is lowering a bit because the changes of hormones. Some women experience that their sleep is more disturbed, and in our digestive system, either loose stools or more constipation is more frequently happening. Bloating and a heavy feeling in the pelvis is also something that we see when we look at autumn in this period of the cycle. Yeah. So here we are, progesterone. This is the hormone that's most dominant during autumn. And you could see it as a blanket hormone, you know, you pull the blanket around you, go inward, slow down. And it's really good actually. Our body wants to take care of a potential fertilized egg. So it's good to slow down and to rest already a bit. And here you see it if there is not a fertilization, there is no pregnancy happening, then all the hormones are going down and we are ready to move into winter in our bleeding time again. And no, this is the menstruation when we don't use oral anticonception. When we use oral anticonception, then that are synthetic hormones that we take in, and these hormones are suppressed. So this is our natural cycle. And we will move into the next part to look at your signs and signals. But again, I want to emphasize each woman's body is different. So not only you and your neighbor, but also each cycle is different. If you have had a lot of stress, you did move or you had an intense holiday, it can be that your autumn and winter is different, that you have more signals and more problems. So please be gentle with this. But we still, however, when we look to many women, we can see some signals that show us that your hormones are in balance or not. So there is not a perfect period, but we do have arguments to say, hey, I suppose I can guess your hormones are quite in balance. And that we will look at now. So what can you expect from your cycle? Length between 23 to 34 days. Days of bleeding from 3 to 7 days. And the amount of bleeding shouldn't be more than 6 pads or tampons a day, or in total 30 to 80 milliliters of blood if you use a menstruation cup. In the body, yes, we can have cramps and tension in the belly, but we shouldn't need painkillers. That is a sign that actually there's too much pain. Breast pain, this feeling of fullness is normal. Also a woman really have that the volume of their breast is bigger. But we shouldn't have cysts or cyclical lumps or real pain in the breasts. Also cyclical headache or migraine shouldn't be the case. That's a sign that your hormones aren't balanced. And yeah, we can have changes in our mood or appetite, the desire for social connection. Yeah, we are cyclical beings, I just said. But they shouldn't take over control. They shouldn't lead you that you cannot guide in any way. You should still be in control. And by making the appropriate changes in your day, that you still have a feeling of balance in your mood and your desire for social connection. Yeah, and let me know. I want to know about you. Do you already track your signs and signals? There will come up a poll. If you already track your signs and signals either on paper or in any kind of app like Clue or Maya or anything. I already will continue. We'll look at your answers in a bit. So, for example, this cycle tracking card, you can download it with our course. We have also launched a course on our website under the topic lifestyle. There you find this tracking card, and this is an amazing thing to do daily, either in the morning or in the evening, to check in with all these different things. Because these hormones go through the whole body, they don't only influence the ovaries and the uterus, but they also influence all the other things I just said. How much did you sleep? Food cravings, movement, what is the desire for intimacy? Did you have sex or not? Something about the waking temperature. This can be interesting to measure directly after waking up. Not going first to the toilet or drink something, but directly after waking up, after you've been sleeping at least 3 hours. This can give us information because after ovulation, our basal temperature is rising a little bit. So it will show that you did ovulate or not. I look at the chat. So, wow. Quite some people not tracking them, but forgetting, or some do, but forgetting it a lot, and others already do. So if you don't do, maybe it's something, a win you can get out of this masterclass. And why? Because it just gives more insight on how you do in your different seasons. And from that point on, what you can do to support yourself. And that's where we're going to go now. First, we will look at nutrition. Let's start with the basics, and as we see here. Unprocessed food. If you can wonder, shall I eat this or not? Just think of your grandfather or mother. Did he or she eat this? If it's a yes, okay, go for it. If it's a no, maybe think twice. So fresh what nature is offering us. And first of all, veggies. See if you can implement enough veggies in your diet, and maybe also as a snack. And not only normal veggies, but also fermented veggies. Any kind of fermented food is very balancing and supporting for your digestive system. Not only veggies, but also, for example, kefir or kombucha is helping your digestive system. And I already noted shortly, but our blood sugar is influencing our female hormones. When the blood sugar is going up and down and up and down, the hormones connected to the blood sugar will also go up and down and up and down. And they, in this orchestra we are in, will influence the female hormones. So in what way can you support your blood sugar? This is by eating 3 balanced meals a day, and each meal having proteins, very satiating, healthy fats, and slow carbohydrates. And this is not always so easy, especially, for example, not for breakfast, but proteins. Think of legumes, think of meat or eggs. Healthy fats we can find in avocado, in nuts, but also in fatty fish. Think of salmon, wild salmon, herring or sardines. And the slow carbohydrates, for example, whole grains, but also sweet potato or pumpkin. If those three are all in your meal, the chance is higher that you don't have these big spikes and don't have your cravings in between the 3 balanced meals. If you have a craving, see that you don't eat something only with sugar or carbohydrate. Add some nuts or any kind of healthy protein or healthy fats to not have this big peak in your blood sugar, but to see that you still have a balanced blood sugar. Yes. So hydrate enough and wisely, water, herbal tea, and the 80-20 rule is really be compassionate. See if you can follow these guidelines for 80%, and all the times you don't do for this 20%, really enjoy it fully. Our brain will rebel against over-restriction, and this will make you more prone to overeat. So be gentle. And these were the basics. I really look forward to you to look at each season. Each season has different needs. So spring, this is the time after menstruation. We've been bleeding, so we want to make up for the iron loss. We will find iron, many know it, in red meat, in dark meat poultry, but also there are plant-sourced iron options. For example, dried apricots, leafy greens, lentils and raisins. Quinoa is also an option. Iron is not so easy absorbed. So if you eat iron, see if you can add a bit of vitamin C. For example, some lemon juice over your spinach. Also, plant-sourced iron is more difficult to take up. So be more aware of your vitamin C adding when you eat something that contains iron. We just saw in spring estrogen is rising slowly, and you want to support that. How? Also again, by leafy greens, grounded flaxseed, very important, freshly grounded, only then you can take up what you need to support your estrogen, and fiber-rich food. In summer, many women experience lighter appetite, so allow it, lighter, simpler meals. And in autumn and winter, your body is going to produce substances that promote inflammation. Sounds a bit weird, but it's good because it is going to help a potential egg to find its home in the uterus. Prepare already to eat some anti-inflammatory food. For example, food with antioxidants like berries, fatty fish, but also seeds during your summer. And then we come into autumn. And I want to show you a story of a client I recently saw. And I see this many times, so please join me, This story of a client, she was 35 years old, stressful job, and having so many mood swings during her autumn. And a lot of cravings, and especially for the stuff that's not helping you so much, like carbohydrates, sugar, and of course chocolate. So what did we do? We can do a lot, but the most easiest change was just to add a little bit more slow carbohydrates, healthy fats and proteins during your autumn. Many women don't allow themselves to eat a bit more. And in the next cycle, we already notice a difference, less mood swings and significantly decreased cravings. So I really want to support you in that, to allow yourself, to give yourself some more energy through your nutrition during autumn. For example, with the whole grains or the other options I just noted. Your digestive system can be a bit out of whack. Do eat things that help your digestive system. Warm soups, steamed vegetables. Please skip the raw salad. That's not that easy for your intestine to digest in this phase. We are more prone to have some bloating in the belly, but also fluid retention. If you want to let it less happening, to skip the added salt, but to promote eating anything with potassium. For example, spinach, broccoli, avocado, bananas and tomatoes. And then when you start to bleed in your winter, you can keep up with your autumn foods. But hey, we're losing blood, so eat food that is rich on iron. If you have a lot of cramps, add ginger either in your tea, in your food, but also mint tea can help. And I said already earlier, the hormone levels are low and this can make us feel more easily a little bit down. And if you have some cravings, choose your healthy treats. For example, healthy chocolate with more than 27% of cacao over raw honey. Yes, our second topic, stress and relax. Now, stress, it's such a container word. We have many connections and associations with it. But first of all, I am honestly happy with my stress response. Without it, I wouldn't be here. I wouldn't get out of bed and to this place here to talk with you. So both adrenaline and cortisol influence many vital functions and we really need them. The only thing in our society, it's so easy to stay in your stress response. No moments to really let go. And that we so easily get just walking heads instead of being connected to our body. So I really support you to have tiny little moments during your day to drop in. To let go for a moment. And maybe 30 seconds when you just arrive at your work or when you start the computer. This little moment, maybe closing the eyes, maybe not, to check in how you feel. And if you sense your stress, this is not a failure on your side. This is your inner GPS telling you you need something else. So be courageous and say no to the things that don't feel like a clear yes. And rest and fun are mostly the best medicine. Think of play, creativity, mindfulness, yoga, massage. If you can, see if you can incorporate some journaling in your week. Getting in touch with your stressors, what can you change, what not. Challenge your thoughts in this. It's a great way, especially during autumn and winter, to check in with your inner critic, because many times it's saying stuff that's actually not true. And last but not least, sleep. Why sleep? Because the sleep hormone, melatonin, is influencing the ovaries. When melatonin is low because of sleep deprivation, it might have an influence on your ovaries and on the ovulation and the hormones we just talked about, progesterone and estrogen. So if sleep is out of whack, it have an influence on your menstrual cycle. So let's take a look how we can support our sleep. And I always say a good night of sleep starts in the day, in the morning. See if you can wake up every day in the same moment in the time of the day, preferably around 7 a.m. And if possible, get already some sunlight in. It's not easy in this time of the year in the Netherlands, but go out, open the curtains. If you're in the office, see that you can sit close to the window to get a little bit of the light in, to give your body the signal a new day started. If possible, add some movement, a little walk. Maybe it's short, but start with the small changes. Our body likes to fast overnight. Fasting is a big topic, and to really go into this, it's from person to person different, if it will support your hormonal levels or not. But in generally, yes, our body doesn't want to eat in the night, and in generally see that you can stop eating 2 or 3 hours before you go to sleep. Have these 3 balanced meals I just talked about. After your work, have a really moment of reset, like a little dance or just chatting with your partner or shower, anything to let work at work and to really have the opening for the evening and for the winding down. If you worry a lot, find a moment of a worry corner before going to bed. So at least 1 hour before going to bed instead of directly in front of the moment you want to go to sleep. Avoid high intensity sports in the evening and skip alcohol because alcohol can disturb our sleep enormously. So what did I say about sports? Yes, let's have a look here. How can I support with my movement my sleep? In the morning, our body is ready for aerobics. And that can be running, but also a brisk walk, anything that higher the heart rate. Then after 3 p.m., there is time to bring in some more power. Our muscles, the muscle tone is more easily going up. We build more muscles more easily in this phase of the day. And of course, when we start to move, our appetites will diminish a little bit because this is the typical moment we crave sweets. And a good thing, injury is least likely in this part of the day. After 7 p.m., see that you can do anything that's a bit more slower, like swimming, yoga, or gentle dance. Of course, maybe this is the only moment you can do any kind of high-intensity sports. See that you have your moment to fully wind down, like a good shower, a long meditation. And know that's not only the intensity of the sports that can bring your stress levels up, but also, for example, loud music during your dancing classes or a lot of social interactions. Anything that's not really preparing you for your sleep, but making you more awake. Also in these moments, see that you plan in some time to fully wind down. So, we're already coming to the end. I'm curious, let me know in the chat, what part of your cycle do you find the most challenging? Really, I hope you got something out of these tips. Maybe some you already knew, maybe there's one little step you can add. And take your time, go slow and steady. One egg takes 100 days to come totally to ovulation. So the changes you make now can have an influence on your cycle only in 100 days. So rather go slow and steady than super fast. If you want to learn more, like I said, we have our course. You also can book a consult with one of our lifestyle experts. And we will soon move into our Q&A. So, thank you for your participation. I see you in a bit in the Q&A.
Rihanna, thank you so much for this masterclass. Such a fascinating and interesting topic, and I think that we don't talk nearly enough about it. We had a lot of questions coming in for the Q&A, so I'm just going to go and start it off. There was a question from Chloe and Paula. It was quite similar, and they were asking if the cycle and the effects of each season disappear if you are, for example, on the anti-contraception pill or you have an IUD.
Yes, so when you have IUD of copper, then it's not disappearing, but in other cases, mostly yes, the hormonal spiral can still can have a little bit of your cycle. Some women don't experience their cycle, but with oral anticonception, these fluctuations we just saw disappears, and it's the synthetical hormones take over.
Okay.
Yeah.
So then you're not experiencing the natural, kind of like how you would have a natural cycle, right? Having the different, let's say, mood fluctuations or energy levels, that doesn't really happen.
Of course, you do have your menstruation when you're in your stop week of the pill, and you still can experience those sensations. So yes, it's still beneficial to check in with your body and see what's needed. There might be a lot of similarities with what I've been speaking about. If there's any other reason why you don't experience a cycle, because you don't have uterus anymore in your menopause, it still can be beneficial to check in with any kind of cycle, for example, the moon cycle, to allow your body to be in different phases and to check in with yourself what you actually need, or yes or no.
Actually, that's great, because there was the next question asking if you don't experience like a natural cycle, what is a way for you to still get in touch more with your body? So you're suggesting to kind of follow, like, let's say, a moon cycle, right?
Yes. For example, because the moon is doing exactly the same as what the female body is doing. So it can be a good thing, and it's a beautiful reminder to get in touch, because yes, the body still has somehow these fluctuations.
Yeah. All right. We have the next question from Michaela, and the question was, is it not advisable to engage in high intensity exercises during winter, aka menstruation?
So what I just said is that most women don't benefit by doing high intensity exercises during winter. Although I've read articles who do support it to do it in this phase of the cycle.
Okay.
Yes, and it was based on certain changes in the body. So see that you don't make your high intensity training too long. In general, to support hormonal health, you shouldn't do a high intensity training longer than 45 minutes to an hour, because it will elevate the cortisol too much. And check in with yourself, try out. If you don't do it, how is your winter then, you know? Yeah.
Kind of treating it like a little experiment for yourself, right?
Yes.
Testing different things, seeing how it feels.
So with most women we see it's not beneficial, but some women do experience benefits by really releasing the energy.
Okay.
Yeah.
Very personal.
Yes, the second day is mostly the day that you bleed the most. So I wouldn't recommend doing then any kind of high intensity sports, because your body is really busy with something else.
Okay, great. There's a question from Iris. She asks, do you have any tips for people that during summer ovulation experience severe lower belly pains, like feeling the ovulation in a painful way?
Yes. So that could be a reason to look deeper on a personal level to see what is happening. Because yes, some women do experience the also called mittelsmerz. So it's the pain of the ovulation. So to check in, how could you balance your hormones? It should be a more personal story. Some takeaways I can give right now. Yeah, now we really have to reflect on the other phases, because apparently somehow the ovulation is giving some pains. So we should really reflect on the different phases to see if we can support that pain. I cannot give a straight takeaway right now.
Yeah, of course. And also, if there are more personal questions, because we saw in the Q&A as well, there were quite a few more personal cases. If you would like to have these questions answered, you can always book a session with our lifestyle experts, such as Rianne, through OpenUp. There's a question from Emma, and she asks, what's your take on taking supplements, for example, like DIM complex or other hormones to support your hormone levels?
Yeah, so I think I'm really happy with this question. First of all, yes, I'm very fond of I think in certain situations it's really helpful to take supplements. But please start with the basics. Start with the basics first of all, to see what we can do with food, with relaxation, with sleep. And then there are cases that can be that benefit a lot by taking certain supplements, but it's super personal. And there are also moments that you don't want to take certain supplements in certain situations. So I don't recommend to just go and grab something, but really reach out to a professional to check in what is fitting to your case. Yeah.
Okay, great. There's a question from Sawad. I'm sorry if I'm mispronouncing your name. How to manage PMS depressive mood, so more of the low moods before the period.
Yeah. So this is something we see in many women because of lowering of the estrogen, and see where you can find more moments to slow down, because this is really what the body wants. And if it's difficult to do in your working day, see if you just have little moments to slow down, to really connect and allow this feeling of being depressed or having a feeling of a depressed feeling. Also with your planning, see if you don't plan your big task in autumn and winter. Maybe talk with your partner about, with your colleagues, if you feel comfortable about it. Put it in your own agenda that this will be your autumn and winter, so that you see that these big tasks are not planned on these days. Maybe have a little moment of 5 minutes or a meditation after lunch, anything that can help you. There are sometimes places in a working environment where it's silent, that you can go there to just be with yourself for a moment and don't join your colleagues on their midday walk. In this phase, it can be very beneficial to slow down and to do a little bit less.
Yeah, and I think that's also an interesting topic because as women, right, like being in the workforce, having so many tasks, so many deadlines, that is a little bit hard to kind of think, okay, I do have my cycle, but then at the same time, I do need to go to work and do my tasks like everybody else, because it seems like, let's say, the working environment is not as tailored to women's hormones, right, and cycles. Is there any other tips that somebody could take into account?
Yeah, so it's not, but first of all, sometimes the breaks and pauses we need are far more smaller than we think. There are studies, if we have 3 breaks of 20 minutes during a day, that we can benefit a lot. So maybe it's not 20 minutes that's possible, but make breaks of 10 minutes during your day. When you're commuting and in the train, maybe don't take your telephone and do anything, but just lay back and listen to a nice song or any kind of meditation. To think of, for example, 3 times 10 minutes of more slowing down, that can have an enormous benefit on your any kind of sensations. And be supported by the fact, if you slow down during autumn and winter, that you will have more energy to shine during your spring and summer. So really, I support you so much to trust on that, and know that if you do a little bit less now, that you will be more able to do stuff later on in the next cycle.
It's also great to hear that it's just taking the small breaks help as well, because I think sometimes we may think, okay, I need a whole day off or a whole weekend off, and then, I can feel better. But I think we really, like you mentioned, underestimate just small breaks throughout the day, instead of thinking that we need to block out our calendar free for 48 hours.
Yes. The mind doesn't understand it, so please just start doing it without understanding it, and enjoy the benefit of it. If you can lay down in these 10 minutes, of course, in many places and work floors it's not possible, but then just grab a comfortable chair, or these places where women can get their milk from when they, how do you call it?
Like breastfeeding?
Yes, when they can do their breastfeeding. These places, many work floors do have these rooms, so go there for your little break, or any kind of silent room. I really support you to do so.
Great idea.
Get your courage out. Yes.
I see a question from Nicole. How long does it take for your cycle to normalize after being on oral contraception for several years? And what are some of the side effects that one can expect?
Yeah. So some of the side effects, that's a whole list. Yeah, but we can have a certain kind of rebound phase, that we have higher male hormones after quitting with the pill, which sometimes can be diagnosed as PCOS. We really have to be patient with this because it sometimes can 1 or 2 years to come into balance again. If there's PCOS being diagnosed at that moment, sometimes they say go back to the pill. I would really support you to reach out to maybe one of our lifestyle experts to see what you can do to support your hormones at that period of time, because there are really good lifestyle advices to bring your hormones more in balance. I don't say it is always 1 to 2 years, but it does can take 1 to 2 years.
Something you mentioned as well that I'm curious about. So if you are going off the pill, let's say you have more an increase of the male hormone and you might get diagnosed as PCOS, but then the solution for it, or one of the methods recommended, is to go back on the pill?
Yes, that's currently sometimes when you go to your GP or your gynecologist, that's sometimes what they recommend, like, okay, you don't have any wish to get pregnant yet? Okay, go back to the pill then, because that's sometimes what they think is the only tool.
Yeah.
But there are other things, but you just have to dive deeper a bit. And not all healthcare professionals are in touch with that knowledge. Yeah.
Okay, interesting. And we have time for one final question. And Ingrid is asking, what is the reason for severe cramps, for example, where painkillers are needed?
Mm-hmm. So this can be a sign that in one season of your cycle you have been taking too much energy, actually, to summarize it in a bit. So if there are severe cramps, it's really helpful to look at the different lifestyle topics and to look at each season to see where can we have a win. If it's the nutrition, the sleep, the relaxation, also the stress levels, because mostly this is a sign that your body needs more and more rest, and probably because it in another moment didn't get.
Okay. Yeah, it's a lot of different elements, right? It's not just pinpointing one thing and saying this is exactly why it's happening. It's kind of like having to take a look at the whole picture.
Think of this orchestra. So if something has been out of whack somewhere else in this orchestra, someone else lost the melody, and then later on you realize. So many times when I have my clients, I see them in 3 or 4 weeks again to just see, okay, what did it do, this cycle. So it's a long breath. Yeah, many times say, okay, for sure we're going to need 3 months, or for sure we're going to 6 or 12 months. So rather go slow and steady. And yeah, I'm happy to support you there.
I also have to say that I love the metaphor of an orchestra and like the symphony of hormones, because I think it puts everything in such nice perspective that, like, yes, there can be, let's say, one instrument, right, that's like not functioning as optimally, and then you can kind of feel like, okay, something's a little bit out of tune, but it's like a very nice visual to think about hormones in such a way.
Yeah. Yes, it is.
Thank you so much, Rianne. Thank you, everybody, as well, for tuning in into this masterclass. As we mentioned, we also have a course available about female health. Thank you so much for joining us. Thank you, Rianne, for such incredible information. And we really hope to see you in the next OpenUp Masterclass in January. And I don't know if that's already officially we can say that, but see you next year.